had a good intro to my next question, kind of talking about patients who may be a little bit older in their disease course. So let's talk a little bit about how does this, so we talked just a minute for, newly diagnosed patients, but how does this differ for patients who are not newly diagnosed with SMA? And how do we approach those who may have had SMA for several years or are into their adulthood now that we do have a few approved therapeutics, and also to that same point, there are some patients who do go undiagnosed for a little bit of time. So, talk a little bit about some of those patients who have already kind of been in and had SMA for some time now and maybe aren't newly diagnosed per se.
And it's really important to think about. I sort of alluded to before, but I think we have to think about the whole picture. So, what is the current medical status of that individual? Are there coexistence of maybe other medical complications related to SMA? So, as we said before, for example, is there significant scoliosis? Is there respiratory insufficiency? How does that impact the mode or type of treatment in terms of delivery route that they would be receiving? Um, and so, for example, with intrathecal dosing, if we're talking about maybe more complex spine anatomy, what does that look like with recurrent intrathecal administration of an SMN-dependent therapy? Does that involve regular lumbar puncture procedure? Does that involve the use of an interventional radiology service to help get more consistent access for the intrathecal delivery? If it's a child who requires sedation and in the setting of respiratory insufficiency, but they require sedation for procedures, how does that play into risks when you talk about potential need for recurring sedated or anesthetic procedures? So again, we think about this quite a bit when we're talking about those risks. We talked also about maybe baseline laboratory. So if there was, for example, baseline liver enzyme issue or GGT elevation, does that sway you one way or another in terms of thinking about how you're monitoring or one therapy over another? So we just again look at it's both what is the choice for an individual in their lifestyle and in their home, what is a preference for type of treatment, but also how does that play into some of their other medical either complications or their medical status at the time when you're considering that.
Exactly. And another point to make is the recommendations are not only for the healthcare providers and for the patient population. It's also meant to be for the policymakers as well as the insurers. And that's really based on the best evidence that's really out there. And one of the things is very pertinent to those who have a long-standing disease, and as Diana mentioned, they have more complex clinical variability. The fact is making sure there is realistic treatment expectations. It's unlike infants, treatment might only stabilize the course over time, or it might slow the decline. And we need to look at those as valid treatment goals in our older patient population. And that's really an important point that had a high consensus among the participants.
Yeah. And maybe to add to that, actually, that's a really important point, Bakri, is you need to know what you're asking as well of the patients and the families for the older individuals who are, again, already have SMA and symptomatic SMA at the time of initiation of treatment. Because do we see a change on scales or scores, for example, in the clinic that show improvement versus is stability, again, still meaningful? And perhaps even if a scale doesn't shift, but are there other things that we can ask about as related maybe to the fatigue component, that things are just easier to do in carrying out your activities of daily living? Or does stabilization of disease also mean perhaps less frequent hospitalizations for pneumonia, for example? So there may be still some subtle things that aren't necessarily even captured fully by some of the scales, but that are really meaningful to the patient's health and also just again to how they go about day-to-day life that are impactful from the therapy. So taking that all into consideration when we're both counseling, but also even in the review and follow up when we're recommending to continue treatment and sometimes justify it as well for authorizations and things like that.
Yeah, no, absolutely. I like that analogy of the patients who are not feeling down as long as they used to be in the past after a viral illness. And so things like that are really very measurable in a different way that the scales aren't really going to pick up.